Yep. Okay. Oh, so we're live. Okay. Um, well, so أول حاجة, hi everyone. Um, my name is Samar Hasan, and I'll be talking about dermatology in the UK. Um, First of all, I don't have Facebook, so I am on Zoom, so I can't see any of the comments. Um, no one in yet, so I'm just talking to myself. خلاص, I'll wait. I'll wait for 5 minutes until people log in, and then Fatma, who's facilitating the meeting, will let me know once we're ready. Okay, hi everyone. I'm getting messages to raise my voice. Okay, come closer. Is this better? Fatma, you're gonna have to type for me عشان أعرف. I think we should start. تمام. Okay. So a bit louder. طيب. Is this better? No, better. Come on. Okay. So hi everyone. My name is Samar Hasan, and I'll be talking about dermatology in the UK. I think you figured out that I cannot see your comments, but Fatma, the facilitator, will be letting me know if there's any problems. And at the very end, if you have questions, Fatma will read them to me and I'll answer them. First of all, I want to thank the Sudanese Junior Doctors Association for the invitation, and especially Reem Asmat, who organized this talk. I'm an ST3 in dermatology in South Wales Deanery. Today I'll be covering a few bits about what to expect in dermatology in the UK as a specialty. And then I'll go through the application process, the scoring for the application, and the interview process. I'll give some tips on the interviews, then I'll recommend a few courses that can help. And finally, I'll talk about dermatology or what to expect as a dermatology registrar, and also the subspecialties within dermatology. And at the very end, if you like, I can take you through my journey to dermatology. We decided to do the talk in English to just make it available to more people. But I'm happy to answer your questions in English or Arabic. So first of all, dermatology in UK is basically medical dermatology. There is very little cosmetic dermatology involved. I think that what people might not expect is that there's a huge surgical element in dermatology in the UK because of the high number of skin cancers. So I'd say surgery is almost 50%. Sorry. Okay, بس كلي على صوتك. So dermatology, a huge part of dermatology is surgery with a focus on skin cancer. So that is a very large part, and I think important. The clinics usually, well, it's a clinic-based specialty, and you get to see a wide variety of cases. There's over 2,000 different diagnoses in dermatology and different subspecialty. As a dermatology consultant, you are expected to do some inflammatory clinics, and then depending on your choice of subspecialty, you may be doing pediatrics or genital clinics. There's histopathology is a huge part, and you have to have basic knowledge on how to diagnose and identify a variety of skin problems and be able to look at slides and make a diagnosis to some degree. There is teaching, a lot of teaching of undergraduate students and postgraduate students, and there's a huge focus on research. So the treatments in dermatology, which I think I found attractive, are evolving rapidly. So there's a lot of new therapies coming out, and I think it's made the field more interesting, medical dermatology more interesting, and oncology, because we actually have much more options for our patients. There's a lot of overlap with other medical specialties. So you have to have a basic understanding of rheumatological diseases and other chronic medical conditions. And in some cases, the first presentation for these conditions are skin problems. So it's important that you are aware of them. And there's a lot of MDT work in dermatology. So you work alongside oncologists and you work alongside a lot of other specialties, medicine, rheumatology, and psychology. There's a huge emphasis in dermatology on quality of life and patient care, patient-centered care, and especially that it's most of the skin conditions come with morbidities, and so it's very important to understand what your patient's expectations are and manage those expectations rather than you manage the patients. It's really reaching an agreed upon target with the patients, and I think that's unique in dermatology compared to other medical specialties. It's the dermatology training is a 4-year training program. I'll go into that in a little bit. So I think as a consultant dermatology, you will most likely have a subspecialty, but not all do. There are still dermatologists who will do general clinics and surgery and do a little bit of everything, and a few who choose to be, for example, dermatology surgeons, and there's a big need for that in the UK. So they basically become, there's most surgery fellowships. I think there are 4 in the UK, and I can talk a little bit about that later on. So to get into training, to be eligible to enter into training, there are a few things that you must complete first. So if you are a UK trainee, then you must have completed core medical training, which is 2 years. More recently, it's called IMT. You only need 2 years. So IMT is 3 years now, but to go into dermatology, you're eligible from IMT 2 to apply for dermatology. Another pathway for IMG doctors who might have trained in Sudan or in the Gulf or in other places is to get signed off an alternative certificate, which is what I did. And basically, it needs to be signed by a consultant who you've worked with in the last 3 years. And it just shows that you've acquired the competencies that the trainees in the UK have, the core competencies. And you can find it on the GRC PTB website. And it's valid for 3 years after getting signed. More recently, there are more new pathways to get into dermatology. So the surgical trainees who are doing the core surgical training now can apply for dermatology. This is quite recent. I think it started this year. So they have to do 1 year in medicine, 1 year IMT in IMT, and also complete the membership exams. So to be eligible, you have to have completed the MRCP. I think during COVID, that was waived, and trainees were allowed to apply and then complete, as long as they're going to complete the membership within ST3. But I think now it's gone back to having, they need you to have completed your membership exam. You might still be able to apply to the interview, but if you have a date for your PACES exam, for example, but you'll only be eligible to start if you show that you've passed the exam. So surgical trainees need to do 1 year IMT and they need to do the membership exam. The pediatric trainees also can apply, and I believe they have to have done 3 years in pediatrics, so ST1, 2, and 3, and completed the MRC PCH membership exams. So it's a 4-year training program. So you start at ST3. The assumption is that you've done IMT1 and IMT2, and now you're ST3. That's why you start at ST3. Now, there is a website that I can share with you later, or I can maybe send to the Sejdem organizers to post on the website. And it has all the requirements for the application process. And I think it's really important that you look at that page yourself. When I was applying, I think, looking at it on a weekly basis and calculating my scores. And in dermatology, every single point matters. Everything, you have to dig and look at your CV and try to get points. And just remember everything you've done in your career, anywhere, and try to get the most out of it. The overall score, the maximum score you can get is 52. And I must say that this changes. So I applied over a period of 1.5 years, and some of my friends have applied after that. And every year, I would say it has changed. So always stay updated. And when it changes, it means that if you think that you might be shortlisted, for example, the lowest shortlisting score is 35, and you think you've got the 35, but then you may get surprised that in the following round it's gone up to 36 or 37, or they've changed the scoring system, and you're suddenly, your score is 32, which has happened to me. So the first part, and this is new, this wasn't there when I was applying, but I really like it. It's commitment to specialty. And I think in dermatology, it's always good to have experience before starting your training. it helps you in your training, but also um, I think it gives you time to think about whether you really want dermatology. And I think dermatology is one of those specialties is either you really, really want it or you do not want it at all. There's no middle ground. And I think I really like that most people in dermatology are really passionate about it, and that comes through. And I think they really like what they're doing, and that's a good energy to work with. So commitment to specialty is 10 points, and uh, the description is quite loose. I would assume that if you, and it depends on what level you're at. So, for example, if you're in core medical trainee or IMT, you maybe maybe try to get a placement in dermatology. Usually they're 6-month placements. I think they're really important. And first of all, if you get an opportunity to get a 6-month placement in dermatology, you can work on your CV, and you'll get a great support from the junior doctors and the consultants if your interest comes through. Always be ready to help, to maybe go to theater, to get to know the other doctors, the registrars. They can always give great advice. You can learn how to do minor procedures, so skin biopsies, curettes are things that you can definitely master as a SHO in dermatology. And also you get great opportunities to present at local meetings. So a lot of our SHOs have presented at the RSM or at local dermatology meetings. And these are all things that help boost your CV. If you're maybe a bit more mature and you've done your core training, but you're still interested in dermatology, you can do get a clinical fellow job for a year, for example, in dermatology. And I think that's even better because you would get to do a bit more work and be more involved in the clinics, and you function at a registrar level at that. So at that point, you'll be working at a registrar level. And again, this is a great opportunity to boost your CV and get the most out of it. And I think you'd be very lucky if you find a clinical fellow job. Usually they're 1-year locum positions around the country. And try to get into surgery, because that might give you an advantage if you're somebody who can operate independently, for example, on lesions on the body. You're obviously coming in at a better position. But that being said, I think the applicants are assessed at the level they're at. So the more senior you are, the more they're expecting you to know. But it's a very loose kind of and a new part that was added to the application scoring. So I'm not quite sure how to interpret it. Everything that you do, you must have evidence for. So in the past, pre-pandemic, you walk into the interview. So I interviewed pre-pandemic and during the pandemic. So I've done the in-person interview once and the virtual interviews twice. So I interviewed 3 times before I got in. So pre-pandemic, it was a huge file that you walk in with and you give it to them and they go through it, and it's just very labor intensive, and you carry it around. You go to Manchester, and it's horrible. Just preparing it was terrible, but it has all your evidence. So everything that you put in this form, you have to have evidence for. Now, the interviews until this, I think until round 2 this year, are going to be virtual. Potentially from next year, they might be in person again. So I'm going to take you through how the virtual interviews go, and maybe in the end, if people, I can tell you a bit more about how it was when I did it in person the first time. With the virtual application, it's much easier. You submit all of these you score yourself. So you look at the table, and for example, if you think you've got 10 on commitment, you just need to have supporting evidence, maybe a letter from a consultant or that shows your job role. You can do some DOBs while you're on the job. So DOBs are basically you do the procedure observed by a senior, can be a registrar or a consultant, and they give you feedback. So that can be evidence that you've achieved competency in these procedures. And again, that can be added to your commitment, showing that you're committed to specialty. Other things that can help is attending conferences, which I'll talk about again later. But that again shows that you're committed. So there's the BAD annual meeting. It's once a year. The next one is going to be in Glasgow in July. So if you're interested, you can still attend that. It's a 4-day conference in Glasgow. And then again, that shows that you're interested. There are a few courses that I'll recommend at the end also that show your commitment to specialty and show that you have kind of gained some skills that are relatable to dermatology. Second is undergraduate degree. So that's not going to change. You can't work on that. If you have a first or second upper, and then you get the full 6 points. I think I'm not sure how that gets in a way translated from our Sudan degrees, but I'm sure there's a way to kind of prove that you've had that. If you did, it'll be excellent. Those are easy 6 points that you can get. And even if you have another undergraduate degree, so a non-medical undergraduate degree, but had first upper in that, you can also use that as your to get the 6 points. Postgraduate degree, so if you have a PhD, you get the full 6 points. For a master's degree, you get 4, and for a diploma, you get 2. Again, when you're looking at these scores, you have to look at what can be done in a short time. So a PhD would take you between 3 to 4 years. It's doable. Some of you might be at that point where they've done their PhDs or they're coming towards the end of their PhDs, so they might be able to claim them. The points, a master's is just 1 year. I think it's more feasible, and it gives you 4 points. And then a diploma, which may take usually around 9 months, will give you 2 points. If you have, for any reason, you have another membership, for example, MRCP-GP, you can include that as a diploma and get 2 points. The next section is honors and distinctions. So if in your in university you had any honors or distinctions, then you get 6 points. If you had any prizes and even poster prizes, you can claim 4 points. And like I said, you really have to go into your CV, and you may forget things that you've done years ago or in another country, and which might be really helpful to add to the points. Next is presentations. And if you have presented nationally or internationally, you get the full points for that. And if you're a trainee in Wales or Scotland, you're lucky, because if you present regionally, so in Wales or a regional meeting in Scotland, that is considered a national meeting. So you can claim the full points, which I think are, let me check. So if you present, that's 8 points. So again, if you're in Scotland or Wales and you presented at a regional meeting, an all Wales meeting, for example, you can claim national points for national presentation, which gives you the full 8 points. You still get points for presenting locally or regionally. So again, if you've presented somewhere, for example, in a regional meeting in Sudan, then you can claim these points. Publications. So you need 2 original publications. I think this might change from next year. I'm not sure yet, but I think it may become just 1 original publication. And it sounds daunting, but an original publication, it doesn't have to be a big project. It can be an audit that you've done and you publish it really in, I mean, to be honest, it can be any journal. It doesn't, preferably you want to target high impact journals, but um, you can really publish in any journal. And if it's original research, you'll get the full 8 points. Until this year, it's 2 publications. You need to be the first or second author. And for 6 points, you can be a co-author in 2 publications, and then it just goes, lower and lower. Teaching is something you can get the full points on, and which is something I was able to do in a few months. So if you create an organized teaching program, and it sounds like something very difficult, but there's so many ideas for that, for 3 months, 3 consecutive months, and you get feedback, then you can get the full 6 points. What I did was I created a workshop for our postgraduate dermatology students. So if you're associated with, and it doesn't have to be in dermatology, it can be anything. So if you're working in a hospital and you have undergraduate students who come to the ward, just create, for example, a organized session for example, history taking, or examining if you're in for example, doing a gastroenterology job or whatever rotation you're in, you can say examining that system, and just make it an organized thing where you're delivering the same kind of training to the undergraduate students over 3 months, and then have a consultant involved in this project. You will see that a lot of the doctors who work with the university and with the hospital will always be happy to be approached about new ideas for teaching. What I did is I created a workshop for the postgraduate students, and I called it Critical Cases in Dermatology. And basically I would just present different cases and within a certain topic. So I did hidradenitis suppurativa, eczema, and I think psoriasis. And that's it. So I had 3 months, and I got the points for it. I got the 6 points. And again, it can be, my friend did a teaching sessions for undergraduate students who are already coming to dermatology, and just made it in a more kind of organized way. So for just 1 or 2 hours, we had students would rotate every 2 weeks. So for every new batch that would come, they would teach them how to do skin biopsies, for example, and that gave her the full points. So another friend, I'm just giving you examples here because it is really an area that you can get points on, who had journal club sessions for registrars. So she was a clinical fellow in dermatology, and she did 3 sessions. So, and then you get the feedback and the proof that you've done it, and just that's your evidence for it. Training and teaching, the maximum points you can get there are 4. And again, if you do is it 4 or 6? Just let me check. Training and teaching is 4, so they've lowered the points, and again, it always changes. So it was 6 when I was applying. Now, if you do a teach the teacher course, which is considered a 2-day course, you can get 2 points. If you do a little bit more, so you do 2 courses, because it's a bit loose again, the criteria for just doing teaching courses that are over 2 days, you can get 3 points. And then if you do a PG cert or a diploma, which takes, I think the PG cert is doable. It might be 3 months. And a diploma is 1 year. And a medical education master's is 2 years. So you need to think about, just to get that extra point. When I was applying, it was 6, but now I think it's easier. I think a PG cert to get 4 points is doable, and it's only 3 months, I think, or 4 months. But that wasn't an option when I was applying. But I think it's definitely worth it now. And quality improvement. So basically, you need to do an audit, and it doesn't have to be in dermatology. So whatever rotation you are in, you can do an audit. You can sometimes be smart if you're in medicine, for example, and you're in renal. You can do an audit on pruritus in renal patients, in dialysis patients, which is a common problem. So you've kind of linked the two specialities. You can be creative in that way. Or in rheumatology, maybe look at the psoriatic arthritis patients. So even though you might not be in dermatology, you can still link with dermatology. If you can't get a placement in dermatology, you can always request a taster in dermatology, and they always welcome that. And you spend 2 weeks, try to form a link with somebody in these 2 weeks, and maybe come up with the idea of doing an audit that's linked to dermatology in another specialty. And pruritus is a good one, whether you're in geriatrics, elderly care, it's quite a common problem that we face in elderly. And you just need to have set up your audits with objective outcomes, so you can prove that what you've done has had an impact. So sometimes people just do audits, and then it's hard. If you pick a topic, or the method that you do the audit with, if you I feel like I'm talking to myself, but so the way you do the audit, if you for example, do interviews and then re-interview the patients, it's very hard to prove that you've made an impact. And but if, for example, you use a tool like the pain numeric rating scale, pain NRS, or pruritus NRS, for example, it's very simple. It's an objective kind of tool, assessment tool, and they do it before your audit, and then 6 months or 3 months later. And it could be something simple. Again, this is an idea taken from one of the junior doctors. Just the impact of giving advice to patients and providing them with information about emollients, and then re-auditing after 3-4 months. So there are many ideas on how to do audits. It doesn't have to be in dermatology. It would help in the interview. I think to show commitment, it would always be helpful to do as much as you can in dermatology, but I'm also aware that people who are in other specialties might not have so much opportunity, but it's definitely helpful. And finally, leadership skills. So you have to have held a regional or national position for 6 months. So that's, again, maybe for people planning to apply in a year or a year and a half. There are many opportunities for leadership. If you're in training, you can be the trainee representative. I know that some people, if you're a member of the BMA, then they've got a lot of positions that come up. But I think I had regional representation when I was in Bahrain, but it's something that depends on how much time you have and what's available. But it's definitely, if you've got a year or two, if you're in IMT or starting your IMT now, then you might want to enroll in something like that. And really, the representative roles are not very demanding, and it gives you well, what is it? gives you a lot of points in the application. So it gives you 6 points. So it's definitely worth it. Now, so once you submit this form, you will self-assess yourself. So you will put the points that you think you deserve for each category, and you will be asked to put a few comments in a box to talk about it. For example, talk about your audit, and it's a very brief thing. Don't write too much. Now, I think it's very important that you do not overclaim or overscore yourself. What can happen is that if it's kind of an innocent error, which things like commitment, things like undergraduate, whether you're first upper or not, you may really, generally not know and overscore yourself, but otherwise, do not put anything on that form that you cannot show evidence for. And I think it comes across really badly in the interview if you get to that point, if you have no proof to back up what you've put on your application form. Now, a few tips that I've put down. Like I said, get a job in dermatology, a fellow job. The registrars can help you with the interviews, especially the younger registrars or the new registrars, because they've just gone through it. You can also form connections. Sometimes you get, as an SHO, you might get an opportunity to participate in books. It depends on which area you are and how active the department is. Always help out when you're in this job. Always show willingness to kind of get involved in projects and audits. Dermatology is research heavy, so they like to publish, get involved in publications, and consultants, would always have projects and case reports to write up. Attend the conferences, courses, the meetings. And if you go to the British Association of Dermatologists website, they've got events and an events page, and you can see all the events that are happening in 2022 and 2023, and you can register through it. And I think, just again, to boost your CV, attend as many as you can, but also it will help you. By doing these courses, you kind of get a head start to your training. And I've said taster weeks and quote improvement and teaching, so I've gone through that. So the maximum scores you can get are 52. I think it's getting a bit more competitive, or it's always been competitive, but it's getting harder now that the pediatrics and surgery trainees can also apply. So I think that plan your application early and get as many points as you can. The numbers continuously change. So I think when I applied, the lowest shortlisting score was 31, but then in the round after it, it went up to 35. So if you're in the 40s range or above 35, you may be comfortable, be sure that you'll be shortlisted for this round, but then again, it might change next year. But it's hard to predict. I think the ratio is 4-1 applicants to positions each year. So there's round one. That's usually, the interviews are usually around February, March, but the application opens in November. And then now there's round two coming up. The application opens up. You need to keep checking the website between July to August or September, August maybe. And after you apply, you will be asked to upload your evidence. So you get an email a few weeks after the application, and you need to apply evidence for everything that you've scored. And if you you get points on your organization. So there's 2 points for organizing your application. So if you, for example, upload things that are not related, you will lose those 2 points, and they're very easy to get. So only upload evidence that is related to your application. So you might think that, oh, if I put more things, it's going to look better, but actually they prefer that this is a verification process. So they look at the evidence and they look at your scoring points, and then they give you a shortlisting score, and the shortlisting score is 20% of the total score. So really all of this is just to get into the interview phase. And your shortlisting score might help you if you're somebody who's planning to go to London, for example. You want the top 5 jobs, but I think that the most of the work is to get to the interview. So your aim is to get a shortlisting score that will get you an interview. Then in the interview, now I'm going to talk about the virtual interviews, but I'm not sure if that's going to be the case next year. I think it won't. But there are 3 stations, and the interview is very quick compared to the in-person interview, where you go into the room and it's 10 minutes, and then you walk outside and sit for 5 minutes, and then go into the next room. When you're doing the virtual interviews, you are in a waiting area first with a few other people, and then you get called into the panel. The first station is always going to be research and academic. So you will be asked before entering the station or the meeting, you'll be given a abstract. And in the abstract, the conclusion is removed. So you get to read the objective, the methodology, and the results. And you'll be given 5 minutes, but usually it's been more than 5 minutes. There's always a delay in starting. Once you go in, you'll be asked to give your opinion on the abstract you've read. And this has been consistent throughout all dermatology interviews, whether in person or virtual. You will get this station, and basically you have to practice how to quickly read an abstract, and you have to do as many as you can, and do dermatology of course articles. So look at the BJD, the British Journal of Dermatology, and the CED, Clinical and Experimental Dermatology, are 2 journals that it will help you, first of all, to get the skill of reading an abstract and quickly coming to a conclusion. But you also need to show that you're, you know how to critique the article. And but I think that's very long kind of talk. And I think I'm not sure how much time we have left. It will also help you because you may be asked to comment on a, we have 15 minutes. Okay, so I'll go a bit quicker. So you may be asked to comment on an article, a recent article that you've read. So it's good to be updated. So I would go through the BJD and the CED in the last 3 or 4 months. Questions until now? I can't see. Sorry, Fatma, I don't understand. 15 minutes until questions, I think. Okay, so and then yes, so you'll be asked about so then you prepare a monologue. So you talk about if you can see what journal it is. So you can start by commenting on if this is it probably will be a high impact journal, and you can mention the journal. You can learn how to critique. So first of all, you need to describe the study, look at the methodology, describe the methodology, so the population, the intervention, and then you comment on the results. And you need to know things like odds ratio, hazard ratio, confidence interval, it shows your understanding of basic research, which is really important in dermatology. And then you may be asked, for example, to mention an article you've read. You may be asked to a question. A common question is, as a dermatology consultant, do you think that research is important? And of course it is. And then you can mention that even if you are not involved in academic or in academia, as a consultant, you need to be able to read the articles and critique them. It's a skill that every consultant needs to have. And then you may be asked about your understanding of research, and you may be asked about definitions of things like confidence interval and so on. That's the research station. So that's the first station. The second is a clinical scenario. And you need to understand that you have 6 or 7 minutes for each station. So try not to make your answers longer than 2 minutes. And that's why you need to practice until you can answer all questions within 2 minutes. In the clinical scenarios, I think in the previous years, the things that have come up are Stevens-Johnson syndrome, toxic epidermal necrolysis, TEN, bullous diseases, so bullous pemphigoid, pemphigus vulgaris. I had pruritus at one point, I had scabies. In the in-person interviews, there was an ethical, so the clinical station was split into two, where one was a clinical scenario. We used to be shown pictures, and then an ethical scenario. But in the last few virtual interviews, there has not been an ethical scenario. An ethical scenario would be a young girl, for example, who you want to start an isotretinoin. That's a common thing. I don't feel like I have enough time to go into the actual questions. And then with the clinical scenario, the important thing is you have to answer the question as a monologue. So you'll get for example, they will say that you have a patient who has come, an 8-year-old male who complains of itching. And you would ask all the relevant questions. So when it started, what he's done so far, any other comorbidities, medication. So just the kind of routine history taking. The only thing that I think matters in dermatology is impact on quality of life. That is very important. It shows that you understand the basics of dermatology. So you must ask, has this impacted your life? How has this impacted your work, and so on, which is very, very important. And then you move on directly onto management. And part of the management is the investigations and then the treatments. And when you are talking about the treatments, you have to talk to the patients in use simple terms when you're explaining things to the patients. You might be asked to kind of tell the patient what you're going to do next. It's very important to not use any medical jargon or any medical terms. The third station, now this is where you get your chance to shine, is suitability and commitment. And basically, you may be asked to talk about your CV. So prepare a monologue, a 2-minute monologue about what you've done up to date. And it's not, yes, they want to know about your CV, but you have 2 minutes to show the things you've done. So don't go into detail about, for example, I've done this audit and this audit showed this and all of that. You won't get points for that, but try to get in as much things as you can. So I like the CAMP method. So C is clinical, A is academic, M managerial, and P is personal. So clinical, so try to hit at least 3 points in each of these categories. So clinical, you can say that I have worked in dermatology and I've done clinics in dermatology. I also am competent in doing skin biopsies, and I have done, for example, a stitch-up course. It shows that you've got clinical experience. Then academic, that's when you talk about your quality and research work. So you can say I've published 2 articles in 2 journals. You can mention just the topics, but it doesn't really add to any points to you if you delve into one of your publications and talk about it and waste your time. And then your academic, so your teaching experience, you can say, so in 30 seconds, mention all your academic achievements. So again, and they're really seeing how they know this, they've looked at your CV, but they're seeing how you are answering the questions. That's part of the interview assessment. So academic, quality improvement projects, publications, and teaching. Don't forget that. So that's 3 3 points for that. Then managerial, you can, for example, say when you're an IMT trainee, you did your MRCP exams and how you were able to juggle busy on calls with doing the exam, and again that shows how you have good time organization skills. And then personal, you might have a personal story about why you want to get into dermatology. You know, if somebody close to you had or your child or somebody, you know, you might have a personal reason to want to go into dermatology. For example, a story about when you were an intern and or a foundation doctor, and you were influenced by a senior consultant and who made you kind of interested in the specialty or so on, or a case you saw on the ward. This is very personal. Now rehearse your answers, but I would say rehearse your points, but not your answers. So know what you will say in each category, and you've got the camp in front of you. That's kind of, you know, you can imagine, you can just see it in front of you and then answer the questions. And the camp method can be used for anything really. So what is the role of a consultant dermatology? So clinical, the dermatologist has to be able to learn a wide variety of skin conditions, have good skills in pattern recognition. That's an important term, pattern recognition, to be able to have interest in surgery, to be able to work in multidisciplinary teams, because there's a lot of overlap between dermatology and other specialties. And then, for example, in academic, dermatology is an evolving field. There's a lot of research. As a consultant dermatology, you may be involved as a chief investigator in clinical trials and so on. And then managerial dermatology, you need to have good time management skills, but also a lot of dermatologists set up services. So that can be part of the answer. So managerial skills, you need to lead a team of nurses and other junior doctors and secretaries. So leadership skills are important. And then personal skills, you can mention as a footnote that there's a good work-life balance, but very low emphasis on that. But it is true, and it can affect your decision, but you need to have a bit more reasons than that. And so these are the 30 stations. There'll be 2 examiners or 2 interviewers, and there'll be 2 other people there. One of them is a layman, and they will be assessing your communication skills. So every interviewer will give you a score out of 5 for the 3. So you get for each station you can get a maximum of 10. And then for your communication skills, you'll be assessed out of 10. And the full mark will be 40. That's 80% of the final score. And your shortlisting score is 20%. That's added, and then you come up with your final score. Okay, practice, practice, practice. If you have a buddy, somebody who you can practice with, that really, really helps. If not, use your camera phone. Look at yourself when you talk. And I'll just, I'm not sure how much time we have left. I think the 15 minutes might be over, but I'll mention the courses. Question time. Okay. Just typing the questions raised until now. Okay, خلاص. I can send the courses to you later. So number 1, what if I had 4-year MD in Sudan? So I think that that is very helpful. You will need to get a alternative certificate signed off by any consultant who has the full membership, and then so that gives you the alternative certificate, and then you can apply, but so in commitment, for example, you probably get full marks, but there are things that are quite unique for UK, for example, quality improvement projects or so on. So I think you can apply. The SCE certificate, it's once a year, it's every October, and there's a new book that has come out for registrars that I can show you. So this is a really good book, and it's on Amazon. dermatology training, the essentials that can help for the exam. And then there's Study PRN, has very good questions. And there's another website sponsored by Lily that that I can share later with you. I can't remember, but it has a lot of questions available. Can you talk about the courses? So the courses with the BAD annual meeting, there's on the first, so there's a pre-conference day where there's an event called Derm School, and Derm School basically is targeting um, junior doctors who are interested in dermatology. So it's attended by medical students or SHOs, and it's only £30. And I think it's very helpful. It gives you a taste of dermatology. There are also some practical sessions. So they teach you how to do a skin biopsy, how to suture, and basic things in surgery, and cautery and keratin cautery and things like that. So I think Derm School can really help. Biology of the skin is a meeting done in December. It's once a year. Again, it can boost your CV. This really shows commitment. Stitch up course. So that's teaches you the fundamental or the basics of stitching and suturing. Now for the interview, Derm Coach and Derm Owl. I've been to both. They're very helpful. And there are some videos on YouTube where you can look at doctors being asked questions. That's really helpful. And teach the teacher courses. Obviously, that can gives you some points. And then if you look at the BAD website, the British Association of Dermatologists website, you can see all the events. So there's histopathology and things like that. But I think the ones I mentioned are what are expected before starting training. The others you can probably do after you get a number. I can add the link to the websites, yes. And I think that's it really. Fatma. I'm not sure, are there any more questions? No one has that. Okay, so there are no more questions. So shall we end the meeting? Just say that you can follow up and reply to questions. Okay, tamam. خلاص. I hope this has been helpful. And if any questions are posted later on, I'm happy to answer them. And good luck to everyone wanting to get into dermatology. Fine. Okay. We can end this now. Just تمام. خلاص, we're done.